Hi there, my name is Louise Norris and I write about healthcare reform for healthinsurance.org. And since it's the holiday season, my fellow writers and I have gotten together to create a letter to Santa where we are asking for some improvements and some changes to the Affordable Care Act and to healthcare reform that's already been very successful in the last few years in this country, but there's definitely still some room to improve. So today I'm with Joanne Boyer. She's the author of a book called Wisdom of Progressive Voices, and she blogs at wisdomvoices.com. She also has a marketing communications business, and she's a breast cancer survivor. So she brings both a small business and a patient perspective to the healthcare reform discussion. So Joanne, welcome, and tell us, what would you like Santa to bring this year?
Well, hi, and thanks, Louise. I decided that much like Ralphie from A Christmas Story, I was going to think big and expect the unexpected and just go for it here with my Christmas wish for single payer healthcare for our country. And while I could provide you lots of facts and statistical evidence on all the advantages that a single payer healthcare system would bring, I think that our first step, especially at this holiday season, is to ask for a change of heart. That ultimately you have to believe in your heart that healthcare is a human right and not a commodity. And no, if you don't have that kind of basic understanding that, as a person, you deserve the right to be healthy, to access healthcare, and to have that as part of any kind of human condition that you would be in, I think that's what has to happen first. So at Christmas season, instead of thinking of, charts and pie charts and diagrams and stats, that Santa, as he starts to build a single payer system, would work for a change of heart around the country as well.
I think that's a great idea, and it's a really good point in terms of reminding people of the moral argument for providing health care to everyone, really. It really is a matter of life and death. Do you envision this as sort of like expanding Medicare to cover the whole population?
Yep, I think that when people describe it as a Medicare for all system, that's a good way, but I take it even one step further, that let's take the Medicare Advantage plans even out of it. Sometimes when you say Medicare for all or Medicare people, you forget people still have that 80-20 split. And so that I would like to just see the for-profit industry out of healthcare entirely. So Medicare for all, healthcare is a human right. And again, I think the ask, while it's big, it is underway, and we can look to Vermont, who's working on legislation this year that, if it passes, will set up for 2017 implementation of a single-payer healthcare system. And not to forget that John Conyers has his bill, HR 676. So the process is underway. We just, again, a change of heart and a will to make this happen. So please, Santa, I'm asking big, just like Ralphie.
All right, well, hopefully Santa's listening. It's a great request, and it would really benefit an awful lot of Americans.